And good morning and welcome to Open Line Online Stream, Sunday, April 19th, the Open Line, the second hour, here on Facebook Live via Zoom. And here in New York City, it's a sunny morning, and we're trying to get through this coronavirus pandemic, especially here in the epicenter of New York, where there is just so many folks that are ill or have made a transition. So without further ado, let me introduce our panel and our guests, starting off with one half of our sports team here, and that is our in-house sports reporter, Bobby Childs. Good morning, Brother Bobby. How are you?
Good morning for team. Good morning, family out there and watching. And I'm going to try my best this week to get the camera angle right. I know a couple of our viewers last week said that the angles of the camera was looking up my nose. So I don't want everybody to look up my nose. But our family's doing well this week. We continue to heal and thank everyone again for all your prayers and warm thoughts and wishes on the losses that my family took. So good to be back again this weekend.
All right, my brother. Also joining us, the other half of the sports team, and that is the sports editor for the New York Amsterdam News, and that is our good brother, Jamie Harris. Good morning, Jamie.
Good morning, fam. Good morning, all the viewers. Once again, I'd like to say my prayers and thoughts go out to everyone out there who's watching. And we know that people certainly are dealing with the COVID, and it's affecting our lives in so many ways. And, people are really, really struggling and hurting. So my prayers and thoughts go out to everyone out there.
There you go. Also, candidate for New Jersey Senator and chairman of the People's Organization for Progress. I call him Brother Protest, and I always say that's out of admiration because of the brother is on the ground, has been on the ground on some of the top issues and keeping things in the news. A lot of folks talk it, but don't walk it. And this brother is about walk it. He is not no radio or social media revolutionary. He is out there in the streets. And I'm talking about our good brother, Larry Ham. Good morning, Brother Larry. Oh, you mute now, brother. You're muted.
Am I unmuted?
Yes, you are.
All right. Good morning, everybody. And thank you team for that introduction. That baptism you just gave me. I appreciate it.
I needed to do that because I commented on one of your threads out there. So better be nice. We'll talk about that one a little later.
All right.
But let me introduce our guests here. The first person up, and they're both my brothers, man. These brothers embrace me, and I really appreciate that. And the first one I want to introduce is the president and CEO of the National Urban League, and he was the mayor of the city of New Orleans from 1994 to 2002, where he left office with a 70% approval rating. I wonder if this man in the White House can come close to half of that. And I'm talking about our good brother, Mark Morial. Good morning, brother Mark.
Hey, good morning, good morning. You got to love the people of Fatim. Thank you so much for all you do to bring the voice to the community. And I'm so glad to be on with all the brothers this morning. And equally, my prayers, thoughts, sympathies go out to those families who've lost people. This is a great tragedy. I've had friends and family members down in New Orleans lose people, and I sort of get rigid every time I get an email or a text from one or two people who sort of keep me plugged in, as well as the frontline healthcare workers. I have a sister who's a physician down in New Orleans, and frontline healthcare workers. They're our soldiers. They're the marchers. They're the frontline warriors of these times. They're not only doctors who are key, and nurses and nursing assistants and nurse practitioners and orderlies and aides and people who do the paperwork and the IT and the people who clean up. All of them, they are going to work. They are essential employees right now, and they're going to be essential employees for a long time. So good morning to all, and great to be with you.
All right, Brother Mark. And this is other brother here. We go way back. A lot of folks don't know and I'll just drop it on to you now. I introduced this brother to Reverend Sharpton, and that because I woke up one morning watching Good Morning America, a little plug for you, GMA, and I saw a story, it was on a Saturday morning, about a young brother that died in a boot camp in Florida, and they said he died from sickle cell trait. Well, a lot of folks know that I'm an advocate and activist for sickle cell anemia due to the fact that my wife lives with sickle cell disease. And I call that BS right off the bat. And I reached out to the attorney, and that attorney was the gentleman that is sitting up here. He's a civil rights attorney and founder of the national law firm Ben Crump Law, based in Tallahassee, Florida. Attorney Crump has represented the families of Trayvon Martin, Mike Brown Jr., Tamar Rice, Elisa Thomas, and Terrence Crutcher, and has worked on many, many more racial injustice cases. Welcome, Attorney Ben Crump, this morning.
Thank you so much, Brother Fatim, and to all the panelists. So honored to be with you all to talk about these important issues that are affecting our community just in the most disproportionate way. The only thing I can really think about, and it's so good that Mark Mariel is on, is I go back and I think about Katrina and how it disproportionately affected poor people of color. And we see that playing out even now. Fatim, as you and I talked with Reverend Al last week, when white America gets the flu, Black America gets pneumonia. And never has that been more evident with this coronavirus. I mean, a magnifying glass has now been put on all of these inequities of not only healthcare, not only access to getting testing, but more prevalently, what I do, I think always about the most basic constitutional rights. And that starts with people's liberty interests and their life interests. And I think of all the brothers and sisters who are in prison and jail, who have been exposed, who are getting no consideration at all in the fact that Attorney General Barr said they're gonna give compassionate releases to people because they know they are in tight quarters and they can't do the social distancing, but 37% white men are being released, and less than 7% of Black men are being released by the way they define what a low-level, nonviolent drug offender is, because most brothers and sisters had trumped up charges from the beginning.
Yes, sir.
That's right. So as you put that eloquently just now, Attorney Crump, let's start with you, my brother. You had a piece that was in the USA Today last week. It was entitled "For Black American, Bias Seen in Coronavirus Response is Continuation of Injustice." And you see across the country, you see more Black folks being affected by the COVID-19 coronavirus. And, you know, some of the reasons are poor health and poor living conditions and the lack of health care. But we're behind the 8 ball because of racial decisions and things like that. What needs to be done, and I start with you, Attorney Crump, to try to rectify this problem?
Well, it's a lot of things. The first thing I would say is, you know, when, no matter what the situation is, poor people of color are always going to get the most of injustice and the least of justice. And that's the reality we always live in. And now with this COVID-19, you start to see that play out in just pronounced ways. I think about the things we have to do. First of all, starts with us. My heart had just broke Mark Mariel and to the other panelists in Pensacola, Florida. You all may have seen it on the internet. It started trending on Easter Sunday in the hood in our community. They had a big block party where you had about 400 people gathered, all looked like us, and they're not respecting any of the social distancing rules. So first and foremost, we start honestly, and we say to our people, we have to understand that we have a lot of these health conditions. When they say it's only older people who have been affected, well, I know some of the families know that's not true personally from their loved ones and family members, but it really is about understanding our underlying health conditions, whether it's diabetes, whether it's asthma, whether it's high blood pressure, obesity, hypertension, any of these things. We have to educate ourselves on that. And then we have to protect those people, especially our elders, from being exposed by young people going out, being exposed, then coming back home. We have to fight that. The other thing I know we dealt with so many times, Fatim, is just the simple things like trying to make sure after we go advocate and we protest and we do get some sense of equity from the justice system and our loved ones come back and they haven't been tested, we have to quarantine them for 14 days away from us. We have to somehow make sure they're in a corner. And I know that's kind of hard when you have such small living quarters, but as you all know, in the epicenter there in New York, this virus is so contagious that you have to do everything in your power to follow the social distancing rule. The other thing I think we can do that is just really simple is we have to be able to get people who are affected into the hospitals. I know, we talk about having good employment. You also want to have good health care attached to those employment. And I know Mark Mariel can speak to those employment issues. But so many of the people, Fatim, even when they try to do the right thing, they're being turned away from the hospitals because they don't have proper health insurance. So we have to have our churches, our clinics, everybody start stepping up and making sure that our people get quality health care when it's needed most. And so those are just a few things that we can do in our community to start fighting this virus, notwithstanding all the things I'm sure we're going to talk about, how we have to make the federal government, the state government provide us constitutional rights that are guaranteed by the Constitution of the United States.
Brother Mark Mariel, I want to bring you in, and as Ben was handing it off to you, Attorney Crump, but I also want to talk about that here in New York, we're still in the middle of this. New Jersey, Connecticut. You heard the president last week talking about he was the one that was going to open up the country. And of course, we see that that's not the case. And he's thrown it to the governors. Yesterday, the president had another press conference, if that's what you want to call it, or if you want to call it more of a pep rally, because that's what it seems like it's turning out. And at these pep rallies, he continues to lie. But as you start to see, some folks are starting to gradually open up things across the country. You start to see some of the beaches in Florida and in South Carolina talking about opening. And people are still sick, getting sick. People are still dying. And we are not testing our folks. So let's talk about that and the racial aspect to that.
So the key to reopening is universal availability of testing. I think we heard that from Governor Cuomo. We've heard that from the public health experts. We have to have universal availability of testing. Tests made in China. Ventilators made in China. Masks made in China. We need to retool the American economy and put some people to work. Build masks here, build tests here, build ventilators here in the United States. So I hope in those places where they are gradually reopening, that the public health experts have green lighted those reopenings. Otherwise, there's this risk of a backlash. This is a silent killer. You can be asymptomatic, meaning you can walk around, not know you have it, transfer it to others. This is not a situation where you're going to have fever You're going to have AIDS. You may have that. It may come later on. So, you know, the public health element of it. The other thing I wanted to say, 2 weeks ago, not a single state had released data by race. Louisiana then released its death data. Now there are 34 states who've released data by race. The number of people tested, confirmed, infected, and deaths. We need all 50 states. We need full and complete data by race so we can get a clear understanding of the disparities that affect this. I want to talk about economics a little bit because I'm really feeling, I don't even want to use the term, about this paycheck protection program where the money is now run out, and how I learned on yesterday from the National Association of Authority Contractors that some big publicly traded companies gained the program by applying for the loans through their subsidiaries in an effort to get under the 500 employee cap, and then walked away with millions of dollars that should have been deployed for small businesses. So I'm not going to support a renewal of this program without the condition that there be money set aside for the very small businesses, for the businesses with less than 10 employees, which is where most businesses in our community, most African-American businesses, most businesses owned by people of color are. Let's talk about the employment situation. 22 million people in less than 6 weeks are now unemployed. This unemployment rate is expected to get to 10, 20%, and it may take months and months and months or more than a year for it to come down even below 10%. We're at Great Depression levels, and the federal government is going to have to step in, provide extended unemployment benefits to those who are unemployed, and then support African-American focus-led, nonprofit, community-based groups to go out and help people navigate to find new employment in connection with this. Across the nation, what we've been doing at the Urban League, we're working from home, all 36 states, all 90 affiliates. However, we're doing food drives in places like St. Louis, virtual career fairs in Charlotte, down in Fort Lauderdale and Broward County. We're doing testing. So we're on the ground and we're working. People have to survive. There's a survival element that is clear and it's present. And since many of our churches and community-based organizations have been affected by this, you know, the Urban League, even in this difficult time, we're going to continue to operate. We're going to continue to do what we can.
You know, hey, Fatim, I just want to piggyback off of what Mark said, just from an economic side. And Jamie and I were exchanging messages this week on this, right? So in addition to some of those publicly traded companies, there were a lot of rich individuals who had their own companies. And there's evidence now that shows many of them signed up for LLC, and where they had yachts and boats and chauffeurs, they actually put those employees underneath the LLC to be able to apply for the PPP. And so they received money where they really didn't need it because they were wealthy, and they found a loophole into this one to do it. There were other law firms, hedge funds. Again, they had a smaller number of headcount in their employee base, but they had expertise. So they had lawyers on hand, they had financial advisors who quickly could put together the documentation that was needed to go get the money. So, you know, they issued, went through $349 billion, you know, 1.66 companies actually received it, but a lot of them found loopholes in it. And this, you know, weeks ago when we talked about this, that was my fear, right? Which was the inability of the government to actually administer it, right? To administer this in a good, sound way. And we already found loopholes. So there's more that's going through. They're going to try to put more money into it. And I just reflect back on what Marco Rubio was saying, which was he was criticizing the banks and for saying, well, you know, you're delaying, you should be able to do this. And the bank pushback was, you need to give us better criteria because this is too loose. And they saw that it was going to be loose, but they just then administered it the way the government said, so you give it away.
And they also advantaged their existing customers. It was sort of like if you went to the bank, if you had the pre-existing relationship, you had money in the bank, you had a loan, you kind of got in line first. A lot of what banks did, they were outreaching, calling their customers saying, come on in and apply. So on round 2, we need a set aside for small businesses. We need some guardrails and some criteria. And I'm going to tell you, there needs to be an investigation to determine who got this money.
That's right. That's right.
They got to do an investigation because this rip-off business, you know, I saw it during Hurricane Katrina, where people ripped off the system. They took advantage of the fact that people are vulnerable, people are suffering. The government has got to do a better job. They've got to fulfill their responsibilities. And in my conversations with members of Congress, particularly CBC members, they, I think, are aligned with what we're talking about, which is to put some controls, guardrails, set-asides for small businesses. A lot of our businesses couldn't react, if you will, that quickly, may not have had the banking relationships, and may have misunderstood this. And so they've got to be controlled. The other thing that happened, and this is interesting, businesses in Texas got more money than businesses in New York, although the unemployment rate in New York is twice as high. And the purpose of the program is to allow businesses to not have to lay off their employees. That's the purpose of the program. So there's, you know, a lot of work to do, and we've got to be out here as you know, accountability agents to hold the feet to the fire, because these are our dollars, these are tax dollars being deployed to help people, and they don't go to the people who need the help.
Who's going to do this? Who's just going to do this investigation? I just want to ask this question. Who's going to do this investigation where President Trump 2 weeks ago removed the independent watchdog for the coronavirus funds, upending the oversight panel? So who's going to do this investigation?
It's up to Congress. It's up to Congress to do the The Congress has to do the investigation.
Right.
And they tried to put oversight in place, and then the administration pushed back against it. I want to speak to what Brother Morial just said, because he raised a good point. At the bottom of this problem is how resources are being distributed. Mm-hmm. And the fact of the matter is that we are all, when I say we, I'm talking about African-American communities and other communities of color, we are the last in line all the time. And what needs to happen, these first 3 emergency relief bills essentially were a bailout for the banks and the corporations, even though they did have a few good things, a few crumbs in there for the people. This 4th stimulus package, emergency relief, that they're talking about doing, number one, everybody in our listening audience, watching audience needs to get online and tell their congresspeople, we need another bailout. It needs to be a bailout for the people. And the resources need to be distributed based on need. If African-American communities have higher rates of COVID-19 deaths and infections, then those communities, excuse me, geographically should receive more funds. That's what Brother Morial just made, was an excellent point. How could Texas get more when New York had twice as high as rate? If New York has twice a highest rate, it should receive twice as much money in my book, or at least more money. One of the reasons we have these vast health disparities between blacks and whites in our communities is because our healthcare institutions and systems have historically been under-resourced. That's why I couldn't understand in the last state budget for New York State They cut $300 million to go to hospitals. How could we be cutting funds to go to hospitals in the midst of a pandemic? They cut $2.5 billion for Medicaid. How could we cut Medicaid in the midst of a pandemic? So resources need to be distributed based on need. And then lastly, one of the reasons Black people can't get help is because we don't have money. Brother Morial just said 22 million people unemployed. But you know what else that means? That means 22 million people don't have health care because we have employer-based health insurance. Insurance should not be tied to your employer, because when you're unemployed, you ain't got no insurance. We need universal health insurance in this country, Medicare for all. And until we do that, this situation is going to get compounded by each crisis. Each crisis, the Black community sinks further and further. And if we don't start doing the structural things that need to be done to remedy the situation, we're going to be in worse shape. We're going to be sitting here 5 years from now talking about we in worse shape now than we were in 2020.
And something, Bobby, you and Brother Moriel said, it's the big banks and it's the existing relationships that these large corporations and these small, quote unquote, small businesses that had, hundreds of employees, they had existing relationships with the bigger banks. There has to be more access to the community banks where people in the community who have really small businesses, where you have 5, 6, 10 employees who were left out completely in many cases of getting some of this money. These small institutions have to be given the opportunity as well to distribute some of these funds and be a conduit, because if you're only going to have the large banks, and again, I'm not just criticizing the banks, because this infrastructure, it's broken, and it was broken from the very beginning.
You're speaking truth to power, and I just got a note across my computer that Steve Mnuchin is saying, quote, we're close to a deal on a new round of money for the small business owners. We're going to keep an eye to see if they set aside, which they should set aside, some money to be distributed by community banks, Black banks, the community development CDFIs, and others.
Credit unions.
They really need to go in and take the whole pool and allocate the pool by state based on need. I mean, so that, people can't, it's just not a rush to see who can knock people down and get in line first. This program, if it's not handled right, is a huge scandal. It's a huge scandal if it is not handled right. It in its intent, it was good. In its execution, I give it an F.
And Brother Moriel, just to go back to a point you made, and Brother Crump, also the COVID crisis has illuminated the huge issues we have in so many sectors of the economy. We look at manufacturing. You pointed out the PPEs, all the necessary chemicals that are needed to create the medicines, the ventilators made in China. This is because these companies took their business to China to get the tax breaks and cheap labor. And now we see manufacturing in this country is completely broken, and moving forward, it's going to be an issue once the vaccine ultimately is created, because all of that will be manufactured in China too. So we'll see certainly a crisis in the supply chain of getting the vaccine and the numbers that are needed here, as we see with the testing.
And with regard to small businesses, we need to put a provision in the bill that puts emphasis on sole proprietors. Most Black businesses right now are sole proprietors. Either the founder of the business, other employees, and many of these sole proprietorships do not qualify. They didn't qualify before the COVID crisis. That's why when you go across the country and you look at all these minority business set-aside programs, when you actually peel back the layers, African American businesses are getting less than 1% from a program that was supposed to be established for helping African American businesses. So we have to change the provisions so that we can, in fact, directly aid sole proprietorships where
Wait,
there are one, two, or
here's the
three
numbers.
employees.
Numbers, yeah, that 85% of all African-American businesses, you're absolutely right, have one employee.
There you go.
He's the president, the treasurer.
That's right.
Manager.
That's
the
right.
supply clerk. I mean, they are doing everything. And that's the spirit of entrepreneurship. And you're absolutely right. Look, this is going to be central to the debate in the presidential election.
Let me just jump in here. I want to bring Attorney Crump in.
But team, before you do that, just so everybody is grounded in this money. So why this is so important? This is basically free money. They are forgivable loans.
Yes.
If you don't displace anyone. So what these companies have done is some of them had enough capital where they didn't even need to let go of their workforce, and they still got in line to get the money. The example I gave around LLCs, they could have kept their staff working, but they said, hey, here's an opportunity to get free money because I had no intention of letting go of my driver. But hey, now I get the government to pay for it. So it is free money. And if you do lay someone off, you only got to pay back a portion of it, not even the full amount. So the way this was structured, it is basically free money.
Right. Now, I want to bring Attorney Crump back into the conversation and everybody here. And this is very important. I'm not saying this is not important. That we need to make sure that these small businesses get what they need, that they can survive. My issue is this. If you look back in South Korea this past week, we are looking at least 163 people that test positive of the coronavirus. They wind up testing negative, got well, and they have retest positive. Laurie Garrett, one of the head scientists, and she wrote the book, The Coming Plague, dealing with the whole Ebola thing. She said we could have two problems. It could be a problem with the testing, which is something that is minor and could be fixed. But she said the second problem is if this bug is a super gene, or a super virus, that people can get reinfected, meaning that if you get this, survive it, build up antibodies, but those antibodies doesn't stop you from getting reinfected. Out of all this money that is being given out, and talk about opening up the government, but now if you open up the government and people get reinfected, and then the other folks that have not been affected get infected, and then we start to see people getting sick again, there is no plan in place. So there's twofold to everybody, but Attorney Crump, the first thing is we do need to somehow get this government running again. And if we don't, we know where we're headed economically. But secondly, we don't know, there's no vaccine, there's nothing right now that can cure this. And if our folks get reinfected, and those that come out here, and then we have another boom on our hand, then all the money and all this to small businesses doesn't matter because we have not solved the main problem. And we're not testing. And if we don't test, how can we open up this government? Attorney Crump.
Great points you make, Fatim. And just a quick note on what the brothers were talking about economics, because I think it play into what you just brought up. And I go back to Tupac. You know, I hosted a series Who Killed Tupac. And one thing I think about when I think about these government bailouts, always what it equates to is welfare for the rich. And as Tupac said, charity never seemed to make it to the ghetto. It never seems to make it to the people who need it most. And that's what we see happening here. And when I think about what you're talking about, the lack of testing and then the re-exposure, which is really something we have to consider because we don't know. I think about the frontline workers, the people who I know, some family members who work in grocery stores, who go there every day and they're being exposed. I know my law firm is involved in looking at potential litigation against these big corporations like Amazon and Walmart, who have failed to provide safe working conditions. I mean, you had the brother in New York who had led the protests against Amazon, who only asked them to shut down for 12 hours to make sure that the facility was clean and sanitized, because they had other co-workers who had been exposed. And Amazon refused to do it. And so think about how many people on the front line who needed those jobs just to keep the lights on, because they understood through history and precedents that there was no bailout coming from them, despite what they were saying on CNN and MSNBC and in Congress at these White House press briefings. They understood what Mark Morial and all the brothers articulated so well, that this bailout was never going to get to them. And no matter what we did, unless we could lock people up and put them in jail for fleecing the government, that's what they were going to do. And that's the inherent problem with the system. When you make the rules vague and ambiguous, then you have people who are part of the legal profession who are going to work for these rich people and tell them how to fleece the system. And it's the taxpayers the people who pay the money, like all these hardworking middle-class people, because we know the wealthy always get out of paying taxes, but always benefit when it's these corporate welfare systems. And so when we talk about the retesting of people, it is real, because a lot of times we haven't even been tested the first time. You know, the people who are getting out of jail, and we represent a lot of them, they bypass them on the testing, even though they know other people in the jails and the prisons have tested positive, and they won't take them to the hospital because they're saying, we're not going to give the hospital beds to a convicted felon when we got other people out here who haven't been convicted. And then you start looking at all those statistics, like 1 out of every 5 black men in states like Tennessee and Texas and Florida are convicted felons. And, you know, if this trend continues in the next 25 years, it'll be 1 out of 3 black men. So you see already the people who are not getting the health care, getting access to the hospitals. And lastly, I will say this, a bit of good news. I have a frat brother down in Miami. You all may have heard this story on social media. It's such a positive story. A young brother working on the front line in the healthcare profession got exposed to COVID-19, contracted it, went through his 14 to 20 days, and then he tested negative for it. And there was a black doctor in Palm Beach, Florida, a surgeon who was helping on the front lines. He contracted the COVID virus. And he then was going down for team. I mean, this brother, older in age, was probably not going to make it. His brother, his blood brother, put out an urgent request online saying, if anybody tested positive and made it through this, we need blood plasma for my brother, a man who's been serving the black community forever. We need you to come forward. This brother, his wife, and his 2 young children made a family decision that if my blood can be the vaccine that saves somebody's life, then I'm gonna do it. So he went in there, gave the blood transfusion in Miami. They flew the blood up to Orlando, got it processed, and then flew it down on Saturday morning to get to the doctor and get him the blood plasma. He's stabilized. He's now recovering.
Wow.
And it is a prime example. We have to save us. Ain't nobody else gonna come and save us.
And for team, if I could ask Brother Crump a question, Brother Crump, you know, Governor DeSantis down in Florida has proven to be just an agent of Trump's propaganda apparatus. And yesterday I'm watching, as Brother Fatim pointed out, I'm watching the news and I see people in Jacksonville on the beaches, they're not social distancing. You know, and I'm gonna give our plug a fraternity. I'm gonna give our fraternity a plug. Omega Psi Phi. Are the fraternities in Florida, the black churches, the community-based organizations, other organizations, truly getting information out to people of color and black communities? Because there's a lot of disinformation that's being propagated by the governor?
It is, and that's a great question, Pratt. I just got this sent to me new. Florida has 1,413 new reported cases of COVID-19 Friday, the highest number of new cases since the outbreak began more than a month ago. According to state health officials, it also reported there was 58 new deaths since Thursday evening. Now consider that and put it in context that Governor DeSantis, this conspirator of our president, has just made a decision where they're reopening the beaches in Florida. And soon they're talking about reopening the state, despite all these facts that this is getting worse in Florida. And so if we don't sound the alarm for Black people, then they won't know. We got to empower them, engage them, and educate them that you can't follow the state leadership on this, because the state leadership doesn't care about your health. He's only trying to do whatever Trump and Mnuchin and all those guys from Washington say, because he's a Republican governor, and you know, they just don't, for lack of a better word, give a damn about poor people. They just care about making money.
One of the reasons a lot of our people are not being tested is because our medical institutions, our healthcare institutions, our hospitals don't have the capacity to do the testing, even if they had the money to buy the test. I know this from experience. I have members in my organization who thought they had COVID, who call up the hospital, who say, I want to come in to be tested. And hospital says, well, can you still breathe? They say, yeah. So they said, well, don't come in. Don't come in unless you're, you know, on the verge of dying. We have, in New Jersey, in the last 20 years, we closed down 25 hospitals. Down south, I just read the other day, in a whole county, like we got 22 municipalities up here in Essex County where I live. In a whole county down south, there was one hospital to serve the people, and they closed the hospital down. We need to federalize. We can't close another hospital in the United States, not one more hospital. We need to federalize our hospitals so that it is almost as difficult as stopping the sun from rising to close a hospital, because now we see, why in the richest country in the world are we setting up goddamn testing sites in Walmart parking lots? Why? In the richest country in the world? Because our hospitals don't have the capacity, because we privatized our hospitals. And then when those hospitals weren't turning a profit, they closed the hospital. You can't base running a hospital on the same principles and practices as running an automobile factory. Hospitals are set up to serve the people when they are sick, not to make money. And until we get that situation straightened out, we're gonna find ourselves right back in this same situation. And if you test somebody and they are positive with corona, if you don't have the money in the bill to treat the people, what hell difference does it make to know that they got the corona and they don't have the wherewithal to go and get medical treatment? This is the problem, that everybody in the United States of America, regardless of their economic position, should be able to see a doctor, a dentist, go to the hospital and get treated and not have to worry about, can they pay a goddamn bill?
Harry made some great points. I just want to say this let me just say this, Bobby. Mark Morial, Jamie, I look at these Black civil rights organizations and fraternities. Right now, we need a state of an emergency for Black America right now, because the issues that everybody is raising here, we need to address, and we need some type of central location that we can plug into, that we know what is being done, what information that we need to get. Because what Larry just said, he's right. He's right on point with this. And I'm asking you, Mark, what is being done by your organization and other civil rights organizations out here to say hey, we are in a state of emergency. We need to do something, and we need to get this information out to our community.
We've spent a lot of our energy working collectively trying to impact these Corona bills, the $2.2 trillion bill. So the PPP program hasn't been implemented correctly.
Correct.
But the unemployment option, where people can apply for unemployment and get enhanced unemployment, was something that we pushed for. Secondly, the PPP program originally was going to apply only to businesses, not to nonprofits and not to churches. So we've collectively been in a number of discussions, but they've been heavily focused on the immediate, which is to make sure that we can try the best we can to impact this legislation. I think you're absolutely right. Now, there are any number of town halls, discussions going on. I don't think for the team it is as centralized as it needs to be, and trying to bring everybody together to do a single thing. I think it's sometimes easier said than it is done. But I think you're challenging us. That is right. Now, on the Urban League, we have a campaign. It's called the Urban League Fights for You. I've got my primary responsibility is 90 affiliates that serve over 1 million people across the nation, and trying to make sure they can keep their doors open, even though they're working virtually, has consumed probably 70 to 80% of my time. Secondly, related to that, we are working right now with a few partners. We hope to have an announcement in a few days on some significant outreach efforts to create an opportunity for the community to have a discussion about what we ought to do. But we do need, and I should say this, with the Congressional Black Caucus, we've been in discussion about what kind of plan we need. What should we be advocating for when it comes to what the brother talked about, the healthcare system. Last night on another interview, I said we need to demand that these states that have not taken the expansion of Medicaid take the expansion. Most of them are southern states where there are a lot of black folk. Secondly, we need to lower, I think, the age eligibility for Medicare from 65 down to 50. Thirdly, we need to create a public option so that anyone that can't get health care through private, through Medicaid, through Medicare, who doesn't want to go to the private market has an option. One of the things we need as Black people to do is we need to ensure that there's health insurance coverage for all Americans, every single American. The way we get there, there are multiple ways to get there. The second thing I think we need to do is they're pouring billions into hospitals. And what we want to make sure is that as they do that, that they're not simply doing it in the same old way, where we're investing in old systems. We need to be investing in new systems that are far more equitable. I want to see health clinics, federally qualified health clinics, dramatically expanded so that every neighborhood, there's access in every neighborhood. And the federally qualified health clinics, you have Medicaid, you get served. If you don't have insurance, you get served at those federally qualified health clinics, but there's simply not enough of them. And then there's an entire economic agenda. So I think you're right. We got to pull things together more. But I will say this, the civil rights leaders of this era, myself, Reverend Sharpton, Derek Johnson, Melanie Campbell, Sharon Eiffel, Kristen Clark, to name a few, we work much more closely together than people realize. We all have to do our own thing. But on COVID 4 or COVID 3.5, we've submitted through Karen Bass, chair of the Congressional Black Caucus, a set of ideas. So we're asking for a moratorium on utility cutoffs, a moratorium on evictions. We're looking for more support to help people who might be facing foreclosures or evictions. For example, a few things that we want them to not only subsidize corporations and states, they need to subsidize cities. This program they put together, Newark and New Orleans and Baltimore are not eligible for. Cleveland and Cincinnati.
That's right.
because they don't have a population of 1 million people. So those are some of the things we're all, pushing for. Our proposal is in the hands of the Congressional Black Caucus. It's in the hands of Charles Schumer. It's in the hands of Nancy Pelosi and our other allies in the Congress. And so we've got to fight and push for all of this.
So Fatim, I want to just go back a couple of questions that you asked around the virus showing up again and people showing positive after showing negative before. There's still so much unknown about this virus and how it interacts with the body. Scientists around the world are just trying to learn on the fly. But if you go back to, as Mark said earlier on, that this is unprecedented times. So you go back in history and you look at some close comparisons, right? So the biggest comparison has been the 1918 flu, the Spanish flu as it was called.
Yeah.
And that hit in March of 1918. And it hit in the United States. So it's weird that it got the name Spanish flu because it started in the United States. It then traveled over to Europe through, in World War I, through all the troops that were there. And while it died down the summer of 1918 in the United States, it came back big time in the fall. In October alone, there were 195,000 Americans who died from the flu. And what the scientists found out years later was the flu had mutated while it was over in Europe. So as the troops went over there and it interacted with other genetic backgrounds of individuals, the flu mutated. So to your original question, there is probably some mutation of the flu based upon the genetic makeup. Attorney Crump talked about earlier on some of the things that are known right now. It impacts individuals who are obese, who have diabetes, who have asthma, who have hypertension. So there's certain genetic markers that people have. And when I see people say, oh, well, they were already in a sick situation, it's a shame that the COVID numbers are being inflated because, look, people don't die just from having obesity. It takes them a while. Is their lifespan cut short? But COVID is speeding it up. So for people who criticize the death rate, saying that, well, just because someone died, they're stamping it as COVID, that's just not right out there, right? This is speeding up people's predispositions out there. So you can go back and see this second wave. So I listen to the scientists and they talk about second wave, and there's already evidence today of a second wave, right? China is reporting cases of a second wave. South Korea is reporting cases of a second wave. Japan is reporting cases. So you do see this second wave coming back because they have broke quarantine. They tried to reopen the government, reopen the economy. People are mingling. And again, remember about Asia, right? That is a culture that probably more than any other adheres to draconian actions by their government. They have been wearing masks and gloves a lot longer than the rest of the world. And so if they're having a second wave, for all these people who are protesting in Michigan and Wisconsin and Virginia and just trying to say that you need to open it up and, pretty much we don't care about COVID is what they're saying, they're putting a lot of people at risk.
And Bobby, for a historical note, the 1918 flu was subscribed the name Spanish flu because the Spanish journalists and documentarians covered it more profoundly than anyone else in the world. So ultimately, it got the name Spanish flu. And as you said, it began here.
Yeah. Now, let me just say this. You know that there have been, what do you call those theories out there where folks have said this is related to 5G and all these other theories out there that may not have anything to do with this.
They're bogus.
Yes, bogus.
Phony.
Right. But this one is not bogus, I'm getting ready to say. And now the United States government, and this has been in the BBC, it just broke 2 to 3 days here in the United States, that the United States is trying to conduct a full-scale investigation into whether The novel coronavirus, which went on to morph into a global pandemic that has brought the global economy to its knees, has escaped from a lab in Wuhan. Now, we all know, and it's true, Mark, that Wuhan has this viral lab there. And now the United States is investigating into this to see if this thing has gotten out of there. We talked about this years ago, even before 9/11, when we did a program on Open Line dealing with chemical and biological warfare. And we talked about anthrax being used in the subway system here and how it could spread through the four boroughs real quickly and how it could bring, a lot of death and sickness. So, like Bobby said, we don't know how. A lot of folks do not know. 1918, yes, that virus killed a lot of folks. And every 100 years, we see something else coming out here. But we cannot just throw away and say something is not right with this here.
I want to offer this though. I'm always cautious,
right?
Particularly when there's an investigation being conducted by quote unquote the Trump administration,
right? In
the context of an election year, where he's sought from the beginning to point the finger at a multiplicity of people. China, Obama, you name it, the governors, the medical professionals, right? He's seeking to exonerate his own responsibility by it's a game of pin the tail on the donkey. Mm-hmm. So I think it should not be dismissed, but I would be wary of an election eve announcement of an of a completed investigation and said, "Oh, it was China who did it." And the problem is that in normal circumstances we would have trust, but if this investigation would be conducted by an independent entity, an outside entity, somebody not connected to the administration, it would, I think, be a lot more credible. I also wanted to say this, and this is just word of hope, right? So right now, according to the World Health Organization, there's 70 vaccine candidates in development, including 3 in human testing. There's a note out of the United Kingdom that a vaccine may be ready for mass production by autumn. Now, I don't know if that's the case, but clearly a vaccine is the end game in this crisis, right? To have a vaccine that allows us to protect ourselves from this virus. So I think we've not heard much about the vaccines, but with 70 vaccine candidates in development, 3 are already in human testing. I'm just going to hold out some hope that sooner rather than later, we're going to have a way to vaccinate ourselves against this wicked, nasty pandemic.
Are you hearing? I just want to say this about that, just to piggyback off of that. Are you hearing that this is reported on NBC News that Black scientists hope to begin testing of an antiviral drug within 2 weeks? This is on Meharry Medical College. President James Hidreth has been advocating for advanced or preemptive screening in Black neighborhoods for weeks. Are you familiar with this?
I'm not familiar with it, but I'm going to look it up immediately. And not that you mentioned that, the lead researcher at, I think it's the National Institutes of Health, is a Black woman.
Yes.
Mm-hmm. University of Maryland, Baltimore County. Her name slips me.
She's fairly young, in her 30s.
Right. I have contact with the doctor, so let's converse about this.
And look, my thing is I want to receive any recommendations, any information, including from any Black healthcare professionals who want to suggest what we ought to be doing.
Brother Fatine, let me just go back to something Brother Mariel said. I think this is important. Mm-hmm. On the conjecture that the virus escaped from the lab. Now they're using the political talking point that the Obama administration funded this lab. So
Right.
as Brother Mario said,
Yep.
you know, as we get closer to the election, and of course they're going to tie that, or Trump wants to tie that to Joe Biden as well, being part of the administration and his opponent. And so we have to be very careful because he's using every opportunity, as Brother Mario said, to blame a multiplicity of people,
Right.
entities, sources, and deflecting the blame. And now, if you look at these press briefings, for the first 30 minutes, 40 minutes, he's not even speaking about the coronavirus or the impact or the effects, the economic effects, the health effects. He's using these as his own political rallies. Just the other day, he talked about reconvening Congress so Congress can continue to make some of these appointments, even though he's already appointed 193 federal judges. He still wants to use this as a political rally.
And
No,
I
but
want
said that-
I want to agree with that. I want to agree with what Brother Morial said about the China thing. Trump is looking for excuses. First of all, Trump shut down the office that was supposed to deal with health pandemics. One of the things we need to do is put that office back in place and then encode it into law, not an act, but a law. It should be a permanent part of the government so that we will have a defense against these pandemics. And then secondly, Trump is looking for a scapegoat. You know, an article came out this week in the New York Times. It showed that if the Trump administration, they had a chart and a graph and everything, if the Trump administration had just reacted two weeks earlier, that 90% of the deaths, of the nearly 40,000 deaths that have occurred in the United States, could have been prevented. We should call this the Trump pandemic, and we should call the resulting economic crisis the Trump depression, because his policies has exacerbated and worsened this situation. And really, it's an example of criminal negligence. Because of these policies, tens of that, not 1,000, tens of thousands of people have died who should not have died.
Right.
You know, just to illustrate what Mark and Larry's points were, right? So that's an investigation you're talking about, right? Let's talk about some facts. And these are numbers that are available. So prior to January of this year, the United States had exported about $1.4 million worth of PPE.
Correct.
The masks, swabs, all that stuff. Through January and February this year, it went from 1.4 to 17.6 million. So we sent and sold a lot of our PPE through exports to China. Now, there are reports that back in November, the national security agencies had started briefing the White House that something was going on with the virus in China. The WHO organization, so who Trump has now blamed, on January 4th and January 5th, sent out a notice to all of the participating countries, including the United States, that there was a serious virus going on. So there was ample time for this president to take action. Remember, he brags about shutting down travel from China. That took place at the end of January, right? So, but he didn't stop travel coming in so someone who went from China to Europe and then from Europe into the United States. So he has a lot. So as Larry said, right, he has a lot of blame on this one. This is facts. This is not conjecture. And so when you scramble and you see the stockpiles don't exist, well, part of it is because we sold a lot of that stuff.
Yeah.
Right? And then what you see now is profiteering taking place that the governors complain about, that they have to bid against each other for it, because you got some individuals in this country who say, hey, I'm safe, but I'm going to make a profit out of it. Even to the point where I've read stories that labs, because there's a lot of labs out there who want to do the right thing, they can perfect tests, but they can't administer it. Why? Because they don't have swabs. So they have the test, but they don't have swabs. And so what some people are doing, they're taking eyelash brushes and repackaging them and calling them swabs. That is just immoral.
Exactly. Let me bring Attorney Crump back in because he has to leave. Mark, how much more time do you have, my
I
brother?
probably got about 2 more minutes. It's about 10, 12
All right.
minutes.
So what we're going to do, we're going to let Attorney Ben Crump have a closing statement, and then Brother Mark, and then we're going to continue on a little bit with our panel. But let Attorney Crump, your closing statement, and then Brother Mark.
Thank you so much for team and to the WBLS family. This panel has been incredible. We need to continue to have these robust conversations to get to the truth of the matter. I leave you with reminding everybody, despite the coronavirus crisis in America, we have to pay particular attention to how they're going to try to use this to erode the civil rights gains and the basic civil rights of poor, marginalized, disenfranchised people, especially people of color. And we got to be on guard. I mean, you can see them already start to talk about things that we can't do anymore because of the pandemic, like the basic constitutional rights. And we have to talk about next time, pertaining the abuses on education, how they're legally disenfranchising our children even more now that this pandemic is going on, and not to mention all the healthcare disparities, all the injustices that we see the jails are doing. Just this morning, I got a report that they are patrolling and policing differently the social distancing statutes when it comes to Black and brown people versus what they're doing to white people. We see all those protests out there. Ain't none of those people getting fined and arrested for being close proximity to one another. But you let a Black person stand too close to another Black person, don't let it be 5 of us. Then the police are coming talking about we got to be fine. So these are things we have to worry about more and more as this crisis continues to go on and spread in the South, especially, as Brother Mariel said, because we haven't seen the effects of it in places like Florida and Georgia and South Carolina and Mississippi, like you all have seen it in New York. But if anything is true, the science tell us it is coming.
Thank you, Attorney Crump. I know you have to leave. I'm going to let you go ahead and lead. Brother Mark, your closing statement.
Hey, Fatin, thank you so much for everything you do to give us an opportunity to speak to the community. And I want to thank the WBLS family and all of the other guests this morning. This has been a great conversation, an important conversation. My reminder to the community is we need to continue to follow the guidelines around social distancing and physical distancing. Here in New York and in other places, they've recommended that we wear masks. And I can tell you, I hate wearing a mask. I've gone out a few times. I hate it, but we got to do it. It's essential. It's necessary. I think thirdly, this discussion about how racial inequity has laid bare, how health disparities are now way out in the open, is an important discussion. But if it's a discussion where all we do is once again diagnose the problem and we can't move forward to fix it, we can't move forward to rectify it, we can't compel our friends and elected officials to do more than pay lip service to it. And our job is to keep the heat on, keep the pressure on, continue to speak truth to power in this instance. 2 final things. I want to encourage everyone to participate in the 2020 census. The census is still ongoing. You can still go online to fill out the form if you don't have access to a computer. You can even do it on a smartphone now. The Census Bureau will be mailing out forms very soon to those who did not fill out the census online. And while the census reports that some 45% of people have filled out the form online, Black and brown communities, we lag behind. We got to catch up. This census is critical The positive thing the census did is delay the door knocking element of the census, which is sort of the last mile of the census, where they go out and knock on the doors of people who've neither filled out the form online or mailed in the form. We have got to do everything we can to avoid just waiting until the door knocker comes. I'm encouraging Black people. We got to understand this is about power and money. Go out and fill out that form online. Look for the form in your mailbox. And when you fill it out, include your babies, include your children, include anyone that lives in the dwelling. Everyone, whether they're related by blood or not, they live with you, they've got to be on the form. So for team, I look forward to a continuing discussion. The Urban League Fights for You at NUL.org is a resource for everyone. And MakeBlackCount.org is also another resource for everyone who might be listening on the census. So thanks for having me, everyone. Happy Sunday, and God bless you.
All right,
Thank
brother.
Ben.
Brother Mark Morial of the National Urban League and Attorney Ben Crump. And you can reach Attorney Ben Crump at ben@bencrump.com. All right, gentlemen. Thank you, Attorney Crump and Brother Mark. We're going to get ready to wrap up in a few minutes.
Can I just clarify something? Because hold on, Tony, Jamie. I just noticed, so some people may have misunderstood what I said about the eyelash brushes. What I'm saying is profiteering has occurred where people are taking advantage of a lack of swabs, and they're trying to sell eyelash brushes as swabs. Doctors and scientists are not using them as swabs. People are trying to sell them and make money off of them because there's a shortage of swabs. So don't feel as though any doctor is going to stick an eyelash brush down your throat and up your nose for it. That's not happening. It's just people taking advantage of the situation.
A quick question to you is something that Larry has spoken about ad nauseum over the last
You getting sick of me?
weeks.
You said ad nauseum.
I hope this don't take us too far, Jamie, because I got one more question because we got to wrap up.
No. And I think, Larry, excuse the term, I think this is very important. How has deregulation affected what we see now? Because Larry has talked about federalizing some of these industries, particularly, the hospital, the medical.
Mm-hmm.
Now we look at, as you said, the profiteering, but deregulation was at the top of this president's agenda when he came in. How has that impacted what we see now, Bobby?
I go back even further than this, right? So Larry talks about big businesses, and we talked a couple of weeks ago about, the airlines, right? So the airlines are going to receive, $25 billion to help them get on there. And I would argue there's a necessity to the airlines, right? And for this reason alone, right? So from a supply chain, and we see already how screwed up the supply chain is, airlines are part of the supply chain to get goods and services from one point to another. So we do need airlines because they are integral in. But they also have 8 million jobs in the United States that are in the airline business that people don't have anymore. So when you think about as an employer to the workforce, and many of those positions we know are Black and brown folks, whether it's the ticket counters, the
baggage carriers,
so they are part of it. So they do need to have it. And the reason I talk about airlines is because you got to go back to like the 70s when they were federally run. So, and then they went through deregulation. And what happened with deregulation, you get all kind of pricing changes and things of this nature. Now, they were heavily connected to unions back then. So when they went to deregulations, that is where the split between the presidents and CEOs of the airlines and the union started to fracture out there. So there's certain industries that I do say that should be federalized and others who shouldn't. But because we live in this polarizing world where everything is on extremes, right? Even hospitals, right? They said, well, if you can privatize these, then you should be able to privatize those. We've even had this debate when, with Reagan and Bush Jr., when they tried to privatize Social Security. So there's just certain things in an economy that I would argue you want to have federalized, and there's other things you shouldn't. And we saw this week play out. You know, the King Trump tried to claim that he has absolute authorities over when he can open up the economy in the United States. And constitutionally, he can't. And you saw some of the governors going back at him and say, no, that's the state's rights out there. And so the deregulation, it should be very surgical where we use it, because I think those are the things that become foundation to the economy that give you some backup if certain things go awry.
Gotcha.
Right.
All right,
I
guys.
just want to add one more important thing regarding what Bobby just said about deregulation. Fatim, what is the drug that people take when they have diabetes? What is that called?
Metformin?
Insulin.
No, insulin.
Right.
Do you know that when insulin was created by the scientists, he gave the patent away for free? The person who created insulin did not gain any profit from it.
That's correct.
Subsequently, corporations are making 1,000% profit from insulin and insulin-related drugs. With regard to COVID-19, many of these companies you cited, Fatim, there's like 75 of them with possible vaccines, they receive some type of federal funding in their research.
Yes.
My position is that if they receive federal funding, they should not be making unrestricted profit. This should not be another EpiPen episode. And that once those vaccines are created, they should be provided to everyone in the United States for free.
Gotcha. That's a good point. You know, excellent point. I have a quick question for you brothers out here, and this would be our last topic here. And Larry, if we don't get to the point that I spoke about your line out there on social media, because it's not really, it's more of a, well, I'll bring it up if it needs to be. But this past week we saw the return of Barack Obama, and I see a piece in the New York Times dated April 18th, the return of Barack Obama. Many young progressives conflicted about the former president's legacy welcome his reemergence this week. And he came back and he endorsed Joe Biden. And this is pretty much right after Senator Bernie Sanders had endorsed Joe Biden. And we all, well, again, I can't speak for everyone. I can speak for myself, but I noticed that when former President Obama spoke, and after he got past the endorsement of Biden, he went into some other things, criticizing Trump without naming him and talking about things. He brought a certain sense of calmness, and you and a lot of folks have definitely missed that type of articulation, especially with the lack of leadership coming out of Washington. This pandemic, this is something we didn't see, and we're in an election year. We can throw so many daggers at the Democrats, but my thinking, and I throw it out to you, brothers, what should the Democrats be doing? And I'm not talking about the ones that are elected. Those are elected, they got to get out there and fight for the people. But I'm talking about Joe Biden, those that ran in the primary with Joe Biden. What should they be doing to make sure? Because again, Joe Biden is pretty much the nominee, and it's his to lead with. But I think that this needs to be a cohesive group of folks, because we are in times, uncharted waters, that there needs to be some type of cohesiveness coming out of here and rolling to make sure that we do not miss this moment. That's my question. That's the first part, is what should the Democrats be doing, especially Joe Biden being the presumptive nominee, be doing out here to keep that pressure on President Trump and keep that message out there and keeping the issues out there that are very important to the folks and the people now that are basically fighting for their lives.
I just want to briefly say, Larry, and Fatin, I'm going to turn over to Larry because, Larry has been saying this for forever. The Democrats now, this is the moment in history for the Democrats to coalesce around healthcare reform. That is the number one issue facing this country right now. The economic issue and the healthcare issue are the two most prominent issues. And I think the Democrats can own it. This is the Democrats' opportunity to own it. Bernie has talked about universal healthcare forever and a day. And I think this, Fatin, is the moment for Democrats to understand that people now see the critical urgency in reforming healthcare in this country. And I do think Trump is imploding. So the Democrats just need to, as you said, Fatin, be cohesive around one or two key issues. And I think that number one issue has to be healthcare reform.
Larry?
Well said, Jamie. There's not much I can add to that. I want to make this clear because I got some calls this week from people that I'm very close to who are concerned about the election. I want to make this clear, and I want Jamie and Bobby to bear witness for me. Have I not said that I would support whoever the Democratic Party nominee is?
You said
Yes,
that.
you have.
Day one.
Yes.
Yeah, but
That is my position, and my position has not changed.
But I questioned you, Larry. When I questioned you the other day.
Let me finish.
Okay.
I'm gonna address.
But I mean, I think the people should understand what you're talking about. That I think they should understand that you put out something that was against Biden, and a lot of folks, including myself, question.
Let's make this clear. Let's make this clear.
Okay.
I have a Facebook page.
Mm-hmm.
We all have Facebook page. I get articles. Articles come to my Facebook page from all the major publications in the United States and some from around the world. When I post the page, first of all, you said I comment. I didn't even comment on that article. You could go through the whole thread. You will not see a comment on there from
that wasn't the question, though.
So,
I asked the question, why did you put something out there like that, criticizing Joe Biden versus...
Well, because I say, first of all, we have to deal with the mechanics of this, because if you don't put it in its proper context, it's going to lead people to draw a different kind of conclusion. And are you talking about, I saw your comment, you're talking about an article that came from New York Magazine, a reputable magazine that had actually come to my page some time ago, but people have been sharing it. When something comes to my page and I share it and I don't comment on it, I'm offering it to the people on my page as an item for consideration and discussion. Unless I attach a comment on there that this is my position or this is not my position, it's something that's offered for consideration, debate, and comment.
But let me ask you this, Larry. Let me just say this, because you could correct me.
And because I say that I'm going to support the Democratic nominee, that does not mean I divorce myself of any critical.
But that's
faculties.
my question. My question to you, and you can answer this. Majority of the folks on that thread, including myself, said to you and about you put that out there for debate or whatever, and it's fine. You have the right to. And this is where you can correct me and correct a lot of folks. I don't see you as when you said you made that statement that you will support the nominee, as you just said here. I don't see a balance. I don't see a balance of you supporting Biden and putting support mechanisms out there for Biden. Everything that I see that you put out so far has been pro-Bernie and against Biden. I just don't see the balance. So how do folks understand what you're saying? That's all I'm saying.
You are not monitoring my page closely.
Okay.
Because anybody who is my Facebook friend will see a multiplicity of perspectives on my Facebook page. I have articles that critique Bernie Sanders. I got articles right now on my page critiquing Bernie Sanders because a lot of people on the left are upset that Bernie even dropped out.
Right. Do you have anything supporting Biden that you said that you would support? Now Bernie came out and supported him.
Wait, let me finish. There are articles on my page that are complimentary of Biden. In fact, I can cite some of the articles that compliment Biden because he has adopted some of Bernie Sanders' platforms or modified versions of his platform. So just because something is on my page, unless I attach a comment to it, you can't assume that's my position. Now, let us deal with the situation at hand. In New Jersey, first of all, we have to go back. Bernie Sanders suspended his campaign. If you go back to the message that he gave, the live message that he gave, that tens of thousands of people, maybe even hundreds of thousands of people have watched across this country, he said he was suspending his campaign. He said that he did not see a path toward the 1,900 delegates that he was going to achieve, that he needed to achieve the nomination, and that he was going to support Joe Biden. Done. Stop. Full stop. But he also said, I am remaining on the ballot. And at that time, there were 26 primaries. There's 24 now because Wisconsin and Alaska have had their primaries. He said, I am remaining on the ballots of the remaining primaries so that I can continue to collect delegates so that we can influence the platform committee and other committees at the Democratic National Convention. The only way that Sanders can get more delegates is by remaining on the ballots and people voting for him. Bernie Sanders is on the New Jersey ballot. He's on the ballot for the July 7th primary. My position is that people who support Medicare for all, free college, double the minimum wage, Green New Deal, stop the wars in Iraq and Afghanistan, racial justice and racial equality, all of those things, that in the primary, they should vote for Bernie so that he can get delegates. There's no other way that he can get more delegates. Furthermore, for him to influence the platform committee, he must have 25% of the total delegates. That number is 1,200. He cannot have any representatives on the platform committee or the rules committee unless he has 1,200 delegates. Today, he has 950 delegates. He must collect 250 more delegates. So in New Jersey, I can't speak for people in New York. In fact, I can only speak for Larry Ham. I am going to vote my aspirations in the June primary. That is what I want to see in America in the primary where Democrats are running against each other and not running against Trump. I'm going to vote for Bernie Sanders so that he can have delegates and we can hold the Democrats' feet to the fire at the national convention to, in fact, move Joe Biden to a more humanistic position on healthcare. Because if we don't, it's going to be, they're going to do what they want to do. So everybody who's worried can still vote for Biden in November. That's when the Democrat runs against the Republican in November, because there's not going to be any unity if we don't have a Democratic Party platform that addresses the needs and the suffering of the vast majority of the people in this country.
Fatin, let me just make this point very quickly. You know, Larry is absolutely right. And I do think, Fatin, and we talked about this for, well over a year. Now that Biden is the nominee and the presumptive nominee, obviously Bernie dropped out, it's going to be so important who he chooses as his running mate. this is going to be an election fatigue of voter turnout, and Trump knows that. And as Larry pointed out, this is why just today, they reiterated that Trump has said he will veto the next stimulus package if it funds the United States Postal Service, because he's going to fight against voting by mail. He wants to suppress the vote. He knows voter turnout essentially means that he will lose the election, high voter turnout. So I do believe that people can't sit back and think that people are going to come out because they're voting against Trump. People are going to come out because they're going to vote for Biden, the vice presidential nominee, and the Democratic platform. And we have to be mindful, Bernie still has a very wide and extensive base. We have to, as I'm an independent, but I'm certainly supporting the Democratic nominee, we have to, Fatin, get progressives out. We can't have young people sitting this vote out. It's impossible to beat this guy if we don't have high voter turnout. So that is critical.
Exactly. That's why I put out the question. I'm not going to get caught up on, because that's one of the things. I'm not going to get caught up with me and Larry, going back and forth on that. It's just something that we discussed, in the past, where Larry has came out and said, because I said the same thing, that if Bernie won, then I'm definitely out there and going to push and support. And I understand what Larry is saying. And that's for those folks that are Bernie supporters. A lot of folks are not, some folks are not Bernie supporters, and those folks are not going to vote for Bernie out there. But I do think that the Democratic Party, behind the scenes, whatever fighting that they need to do, they need to do this now. They need to have these conversations now and then come out as a unit. Yesterday, I'm glad that Reverend Sharpton showed where he got chance to interview Stacey Abrams. He got that got through before his Politics Nation show was interrupted by. It was a great interview, and Stacey Abrams is basically saying that she would accept if she is picked to be the VP running mate of Joe Biden. Now, a lot of people are looking at Kamala Harris. Now, does Joe Biden owe Stacey anything? Or does he owe Kamala something? I think Joe Biden may feel that he owe, even though Kamala went hard at him in the debates, by her endorsing him, I think that, he may feel that he owes something. And I think that that's going to push some of these progressives away if he picks Kamala Harris, because it's going back to the same old good old boy network.
Liberalism, and again, everyone knows Stacey has been my number one choice, not just for vice presidential nominee, but as a presidential candidate. And I do believe you have to pick someone who can essentially coalesce the progressives and the moderates in the Democrats. Right. Kamala can't do that. She's highly intelligent, a very capable politician. But again, progressives are viewing her as a neoliberal and someone who cannot bridge that gap. And that's what's most important, because there is a divide. There's no question about it. But that gap has to be bridged. And I do think Stacey can do it. She is my number one choice. And I also think Elizabeth Warren has the potential to do it. I don't think Kamala can do it.
But who can grab some of these moderate white men? I don't think either one of those picks will grab the moderate white men right there. And we're going to need some of them in these swing states.
But Biden does that, though, Fatin.
I hope so.
Yeah, I think Biden does that.
Bobby, you've been quiet.
So to your question, right, I echo some of what Jamie said, right? So, for the Democrats, to me, focusing their platform on issues that span different races, genders, and economic statures, right? And so healthcare fits that definition. This pandemic has hit all gender, races, and economic statuses out there. Work protection. Now everybody is impacted by this, right? So that spans, is it a black agenda, a brown agenda? No, this is an agenda, right? The other one is around development. So when people were saying this in good times, it was poo-poo. But now when you look at it, right, and you think about, we talked earlier about, all the outsourcing of jobs. Let me let everybody know, jobs are not coming back the way they were before. And I would actually argue want some of those jobs because low-skilled jobs, what we have not done a good enough job here in this country, in my opinion, is how do we keep elevating our game so that people gain more valuable skills so that they put themselves in a position so that they can earn better wages. So, education, job skill development, work protections, and healthcare, to me, span it all. So when you talk about getting the progressives and the moderates, to me, that would focus on it. Then after you do that, you got your secondary layer of things that do focus on different sectors. So you get criminal reform, you get gender pay, you get climate reform, you get opioids. So it's not to say that those things are not important, but to me, those are more second tier that you can then go towards folks who are or much more segmented around it. So to have that kind of balance, and and I know there's a lot of criticism against Joe Biden, but I look at this: the criticisms of Joe Biden, legit as many of them are, pale in comparison to who we have in office right now. What Jamie had talked about around his press sessions right now to educate the country on where we are combating this pandemic, and he spends the first 30 or so minutes doing campaigns, showing videos, right? And then he sends out tweets, and Brother Keeley, when he was with us, said this, and it resonates, right? He's going to cause a civil war. Well, he sent tweets out this week saying,
right,
liberate Michigan, liberate Wisconsin, right? So he's gone after states that he knows he needs to vote for him for re-election. That is political. He is not worried about the safety of individuals. He's being political. And then the last political thing you noticed out there, going back to Florida. So someone has to explain to me how Worldwide Wrestling, WWE, has been deemed an essential service in a lockdown. So yes, they're not going to have crowds there, but he's allowed them to continue to film their show so that they can, and his answer was, well, people are getting tired of watching reruns. What kind of answer is that? And then you go back, you look at it, right? Vince McMahon, married to Linda McMahon. She was part of the Trump administration. She ran the Small Business Association. She left that position. That Ron DeSantis gets money in. So of course, he's going to allow them to run their business, which then opens the door for any other sporting entity to say, well, if you allow them to be essential, I should be essential as well.
Exactly, Bobby.
We got
to wrap up, guys.
I just want to add to. You got 1 minute. I want to add to the healthcare issue that Jamie was talking about.
1 minute,
so
Larry.
Throughout the campaign, Joe Biden argued against Medicare for all up through the last debate. After Sanders suspended his campaign, one of the things he said was that he would lower the threshold age for Medicare from 65% to from 65 years old to 60 years old. Today on the show, Mark Morial said that the requirement age for Medicare should be lowered from 65 to 50. You see this bargaining that's going on here. Our position is we need Medicare for all in the face of a pandemic where 40% of Black people are represented among the poor, have the highest rates of health disparities in terms of the impact of COVID and everything else before COVID. We need a new healthcare system. Who argues for a new healthcare system and who argues against it? So we're trying to push the party in a direction to help the people. And yes, we must defeat Trump. Worst president in our lifetime. Everybody know I'm the one that led marches, impeach Trump marches, and Trump must go marches every year since he's been president. But that's not enough. People want change. The poor catch hell regardless if the Democrats or the Republicans are in the White House. This is what Reverend Barber is saying. We need change.
Thank you, Larry. And not to push that, even though our clock is out, I do agree with what you're saying there. I want to leave you with these words here today. Yvette Grayson Jackson sent this in just a few minutes ago, and she states, Democrats fall in love, Republicans fall in line. Let's line up, y'all. I think that was right on point. Thank you. Thank you, Yvette. Yes.
Just for the listeners, because I know a lot of people have reached out to me who couldn't watch the show. I mean, the Wednesday night show and all these shows are getting such great responses. And so people said if they can't watch them live, can they somehow get the link to go back and watch them?
Okay, so what they can do is they go to WBLS.com. Go to Facebook. I'm sorry. Go to Facebook. Go to Facebook.com. Go to WBLS 1075 NYC, just the WBLS page, and then go to videos, and then scroll down, and you'll see us there. Now, what I will do, and I will talk to our digital team because they blast it out on YouTube and everything else. I'll find out if they can provide a link that maybe we can put up somewhere that they can go back and see this, because you're right. This past Wednesday, we had the president of Downstate Hospital in Brooklyn, and then we also had Governor Phil Murphy from New Jersey. So we did have a good panel, and looking forward to having another good panel this coming Wednesday at 8 p.m. And I was talking to VP of Programming, Skip Dillett. So he's given us 2 hours. The first week we did 1 hour. It was too short. 2 hours is a little stretch. So anywhere between 90 minutes and 2 hours, we will be in there, depending on the number of guests and the content of what we have to discuss. But again, we will be on this Wednesday, 8 p.m. for at least 90 minutes up to 2 hours. I want to thank our guests today, Mark Morial, President and CEO of the National Urban League, and attorney Ben Crump, civil rights attorney and founder of the national law firm Ben Crump Law. I want to also thank our team, Bobby Chow, Jamie Harris, Larry Ham, and Nitha Khan is off today, but I expect her to be in saddle this coming Wednesday night at 8 p.m. I want to thank our production team. I want to thank my producer, Knowledge Born. I want to thank our digital producer, and that is Brother JB behind the scenes. All right, we will see you Wednesday at 8 p.m. and then, of course, next Sunday around between 9 and 9:15 a.m. All right, thank you, everybody, for joining us here at Open Line Online. Bobby?
All right, so everybody, as we always say, get your mind right. And I noticed in the comments today, we had some folks who had some opposing views and some who said that people are misinformed. And as Bob would always tell us, go out there and seek as many different perspectives as possible. We provide this for you every Sunday and now Wednesday so that you can gain this perspective. Keep your mind open to hearing different things, form your own conclusions, deal with the facts and the emotions and the rationale. And so keep your mind right and keep a good thought. Thanks for tuning in.
All right. Take care, everybody. Goodbye.